Welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
I'm Dr. Brad Weening.
And I'm Dr. Nicole Callan.
Dr. Callan, thank you again for coming as a visitor on our show here. What are you going to talk about today?
So I thought another very important topic was anal fissures, actually. So oftentimes I'll see people in the office who present saying that they have a hemorrhoid. But I think it's very important that people know that not all pains in the butt are actually related to hemorrhoids. Some can be due to anal fissures.
So are they mostly coming with the blood or the pain or both?
So generally they'll come with both when it comes to anal fissures.
Okay.
The real differentiation with anal fissures is usually it'll be triggered by an episode of constipation or diarrhea. That episode of constipation can be also related to a really hard bowel movement that passed. And then all subsequent bowel movements can be extremely painful, where as the bowel movement actually comes out, you feel a sharp, stabbing, debilitating pain in your bum, even potentially spasms in your pelvis as well.
Okay, so that would be the hallmark symptom of an anal fissure?
Yeah, so bleeding and pain with a passage of a bowel movement, which differentiates from hemorrhoids because hemorrhoids will have painful hemorrhoids will have an obvious lump, where with a fissure you won't see a lump. And sometimes you won't even see the little tear.
Okay.
A fissure is a tear in the lining of your bum.
Okay, so I've been to the washroom. I've experienced excruciating pain. I think it might be an anal fissure. What do I do?
So the first thing and most important thing is start your fiber and also consult with a doctor so that you can actually get a clear diagnosis of what is giving you the pain. But start your All Bran Buds quarter cup every day because that's going to be really what's going to regulate your bowels. And what we want is to regulate the bowels. The bigger, the bulkier the stool, it's very counterintuitive. You actually want to have big bowel movements because that relaxes the muscle. The smaller the bowel movement, the more the muscle has to contract, and then the tear gets actually pulled apart.
But you want a big soft bowel movement. You don't want a big hard bowel movement.
No, you don't want a big hard bowel movement. You want a big, and that's the buds or Metamucil, if you're taking the correct amount, can give you that big bulky stool. And that allows that muscle to relax so the fissure can heal.
Okay.
But people they think if I have a big bowel movement, I'm actually going to make it worse. So they'll often avoid eating, they'll avoid having bowel movements, and that actually perpetuates the problem.
Okay, all right. So what are some of the complications of these? Let's say I've done that, I've ate all my All Bran Buds.
So you've tried your buds and then you've seen a doctor. You should at some point see a doctor. If you're still not, most people will get better within about 4 weeks. If you're not better, then you can be prescribed a medication which is a muscle relaxant that you would apply on your bum. So if this is your bum, you just take the cream and put the cream on your bum 3 times a day. There's various different kinds. Some are better. Every physician probably uses similar to slight nuance of difference, but anyways. And then if that doesn't work, what we have done now for refractory cases, so cases where they don't get better with the fiber and the medication, is to give them anal Botox.
Okay.
Now to diagnose it, Nicole, can you use an iPhone in a mirror like Paul Rudd did in This Is 40?
You could.
Oh, really?
You could, because you'll see the lack of a big giant
Hemorrhoid.
cluster of grapes, which is the hemorrhoid, the painful hemorrhoid.
Okay.
So the bottom line on anal fissures is All Bran Buds.
All Bran Buds, you do want to be...
Sorry, that was a slip of the tongue.
All Bran Buds, see a doctor just to confirm the diagnosis. And if that doesn't get better, there's something else that's actually really important. As it heals, it gets exquisitely itchy. And so people will sometimes wake up scratching their bums, and they get very stressed about the itchy bum.
So hey, if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own health.
See you next time.